Asia-Pacific is the most diverse region in the world. It offers a kaleidoscope of diversity and disparity, both within and across countries. Rockets and bullock carts, billionaires and the destitute, luxury resorts and sprawling slums sit side by side in this vast region. Some countries have achieved the highest living standards on the planet. Others are struggling to meet basic needs. These disparities are stark in the pursuit of the Millennium Development Goals, or MDGs, the time-bound and measurable targets for socio-economic advancement that national leaders committed to at the United Nations Millennium Summit in 2000. Countries in the Asia-Pacific region developed national plans and strategies to achieve these goals by the year 2015. 5 years on, there has been some remarkable progress. The region is doing relatively well on the first 3 MDGs. Over 250 million people have moved out of poverty. This reduction is the most impressive in recorded history. More children are going to school than ever before and stay there for longer. Importantly, this includes almost equal numbers of girls and boys. But we are not doing so well on the other goals. Many countries in the region have a long way to go before they achieve the other MDGs. This is particularly the case with the least developed countries, or LDCs. A worrying trend is the worsening conditions in some countries. And even in countries that are doing well, national averages may hide disparities across different areas. Major gaps exist in South and Southwest Asia. Let's take a closer look. One of South Asia's biggest MDG concerns is the health of mothers and young children. In many South Asian countries, we have made little headway in improving conditions for pregnant mothers and their babies. Over 250,000 women die every year during pregnancy or childbirth. 20 times as many women are injured or disabled. 22-year-old Reena lives in Dhaka. She was married by 13 and had her first baby while she herself was still a child. As a result, she lost control of her bowel and bladder movement. After 6 operations, she's still not cured. Thousands of other young women across the region don't live to tell the tale. Many women die at childbirth because families and society do not view their healthcare as a priority. And the babies who survive face a long, hard struggle. The first 5 years are the most treacherous. Every year in the Asia-Pacific region, 5 million children die before they are 5 years old. South Asia has more underweight children below 5 years than in the whole of sub-Saharan Africa. Malnourished children are weak and become easy prey to many childhood diseases.
Solutions are not so much medical, because medically we have the know-how. This is really on a large scale socio-economic problem, which relates to literacy of women, education, people having job opportunities, population control, hygiene, availability of food which the parents can afford.
These are needs within the MDG framework, but governments alone cannot make it happen.
Health for all can never be achieved unless the people take over. And health needs to be their goal and their target, and the technological choice should be the choice of the people.
Strengthening primary healthcare systems to achieve the MDGs is a major challenge in many countries. In Bangladesh, for example, health services are now being taken to the most needy communities. Every day, Sister Sumanti Biswas examines patients in slums across Dhaka. She tells pregnant women how to look after themselves. Women who had earlier suffered due to ignorance are also joining these efforts. Reena now spends a lot of her time caring for and working with young women. She knows that timely information saves lives. Water and sanitation are essential for health. Finding fresh water is a daily struggle for millions. People spend hours each day searching for water. Often when water is eventually found, it's too polluted for drinking. Factories, hospitals, urban households all pollute surface water. Keeping surface water clean and safe is indeed possible, but many cities don't treat their sewage or other waste. Sooner or later, much of it ends up in the waterways. Closely linked to clean water is sanitation, which affects both rural and urban people. The problem is especially acute in megacities. Here in Manila, for example, most at risk are those who live on the edge of Manila Bay. They receive much of the city's raw sewage and industrial waste. Solutions to these formidable problems emerge when local communities, government agencies, and private companies work together. Almost 2/3 of Karachi's population live in squatter settlements. This one in Orangi has 1 million people and clean streets. But it wasn't always like this.
It was terrible. The drains were overflowing. The dirty and clean water mixed together and the children kept getting sick.
Community members worked hard on this transformation. Thousands of community-based organizations are now responsible for much of Karachi's infrastructure. Their pathfinder was the Orangi Pilot Project, a self-funded grassroots movement that relies on people's resources and skills. Using local materials and labor, they built hundreds of kilometers of low-cost underground sewers. While such efforts are promising, they need to be replicated and scaled up. To achieve MDGs in Asia Pacific, governments, private sector, civil society and local communities must work together. The next 10 years up to 2015 are crucial. A better future is within our reach if we act now. We need to invest more resources. We also need to reform institutions to empower millions still in poverty and protect their right to development. Given the sheer size of the Asia-Pacific region and its population, the global quest for MDGs will be won or lost in this region. Collectively, Asia-Pacific has the resources, skills and expertise for a massive surge forward. For MDG progress, change must happen at all levels. Countries can also do more to help each other. There are new opportunities for South-South cooperation. MDG interventions could include harnessing the region's financial reserves. We also need better targeted investment and donor aid within the region. This is a realistic vision of a future within our reach, a future shared by all people across Asia Pacific. Together, we hold that future in our hands.